September is National Sickle Cell Awareness Month, a time to turn the spotlight on this debilitating disease. In fact, by the end of this year, more than 1,000 children will be added to the ranks of those born in the United States with sickle cell anemia. Some of them may face a lifetime of blood transfusions because of it. All of them stand a good chance of living life in pain. But as Rod Starnes now shows us, doctors have found a way not only to treat some of the kids, but to actually cure them.
Okay, you got me.
Even though she has to wear a mask to protect against infection, Kimmy DeSir really doesn't mind. She recently had a bone marrow transplant to treat sickle cell anemia, which often left her in terrible pain.
You hurt everywhere, mostly your chest or your side. And mostly if it's your chest or your side, it's either you have acute chest syndrome or it's either you have pneumonia.
That's because the red blood cells in Kimmy's body change from the shape of a donut to the shape of a sickle, which means they can no longer effectively carry oxygen to different parts of her body. That could have meant a lifetime of pain and discomfort for Kimmy. But because of her bone marrow transplant, Kimmy is cured of sickle cell disease. Just a year after her surgery, she has no pain, and her doctors say she has no increased risk of infection because the transplant is allowing Kimmy's body to make healthy red blood cells on its own.
Hey, April. How you doing and how you feeling today?
While it's a significant breakthrough for these patients born with a disease that was once thought incurable, doctors caution patients about being overly optimistic. To date, Kimmy is one of only 100 or so kids to ever undergo the procedure because it's still very risky. And there's also the problem of finding an appropriate donor.
We have difficulty finding suitable donors. It must be a full sibling match, which is difficult. It cannot be a half sibling. It's usually not acceptable to try a parent or a cousin. And certainly if you have a twin, that's going to be inappropriate because they're going to have sickle cell too.
Finding a matching donor was a welcome relief for Yuli Carmona. Her youngest son, Jonathan, now benefits from a bone marrow transplant thanks to his sister, Mitzi.
She gave out cells for the bone marrow transplant, and it's a new life right now. For me, it's a new life because he can go to the school. He's happy. He's no more sick. Okay, he needed attention, he needed medicine, he needed time, but it's okay. It's better.
But not all of the news is good. While Jonathan was a candidate for the transplant, his older brother, Ellie, for various medical reasons, was not. Older patients living with the disease, like Ellie and so many of Dr. Adams Graves' other patients, serve as a sobering reminder that there is still much more to accomplish in finding a cure for all patients living with sickle cell anemia.
Hold your breath a second.
With more education and funding, doctors are hoping to see even greater improvements in caring for these older patients. And they're looking forward to even more success stories like Kimmy and Jonathan.
So how long has it been since you've had your transplant now?
3 years.
About 3 years.
For Smart Medicine, I'm Rod Starnes.